Welcome everybody to the P. Frank MD 2025 Year in Review. We're going to talk about what we saw all year and what is to come in 2026. What's the main gist? It has been a year of injectable awakenings and surgical and regenerative hype. So let's get down to it. First and foremost, people are finally realizing that injectables aren't the answer to everything. People tend to be polarized in this culture in every aspect of the word, but particularly in aesthetic medicine. And anytime there's something of hype, people want way too much of it. And for the last decade, injectables have been a little overdone. Now, I've always liked to think that the best providers have always used things judiciously, knowing when to use the right amount of injectables and when it's just too much, because there is such a thing as too much of a good thing. And one of the feedback that we've been getting all year, we've seen a numerous number of arrests of not only bad providers, but really illegal providers, people that shouldn't be doing these injectables at all. We've seen med spas that are doing things inappropriately closed down, and people have just generally developed this kind of filler fear, I like to call it. Now, unfortunately, people swing back to the other side of the polarity, and people are afraid. People who actually still need injectables are becoming more afraid of it. So this is not a bad thing. It's just a great time to reflect and to re-educate, because injectables aren't going anywhere. One of the reasons why 40 is the new 30 and 50 is the new 40 is because the injectables that have been around and invented decades ago have really been part of the reason we've all been able to stay young and age gracefully. So there's going to be kind of a balance that we see, particularly in the next year. Now, another thing we have seen this year, it has been the year of celebrity surgery. Again, I have always been a huge proponent of telling patients when it's time to go under the knife and to just give people the option. Now, some people are too afraid. They don't want things like risk or downtime. And then there are some people that are more open-minded to it. And one of the great things that we're seeing in the media now is that there's just a lot more, people are more open about it. I think people are more open to admit that they're getting surgery. I think the techniques are getting better. I think there are more surgeons that are getting more and more skilled and experienced, not only in facial plastic surgery, but in body surgery. Also, there are a lot of different types of people getting surgery done now. We're seeing people, men, women, different ethnicities are getting it done. We're seeing a lot of different age ranges. We'll get to that. That could be a bit of a problem. But I think, when there's a larger mass of people that are doing a particular procedure, surgeons can develop the nuances that are necessary. And we have seen a lot of celebrities, speculation, and admissions that they've been getting procedures done. Now, things are getting a little overhyped. We're seeing a lot of before and afters on social media where you see a really bad before picture from years ago, and then you see the 2 weeks, I'm still swollen and my skin looks really nice, tight and shiny, and is face-tuned with Photoshop and other apps. You know what I'm talking about. But there are a lot of celebrities like that where, unfortunately, I think it's giving a false impression of what surgery can do. Surgery, although great, does have more risk than non-invasive procedures. It is an imperfect science. There are people who are better and worse candidates. And I think one of the things that we're going to see with surgery in general is, with a much greater demand, we're also going to see a lot more providers out there. It was the year of the deep plane facelift. I think although there is some argument out there, deep plane is one of the most extended deep plane is one of the more advanced techniques that physicians and users are using. And I can tell you from experience, I have patients that see surgeons all throughout the world. There are a lot of people out there that are saying they are doing the deep plane facelift, and they are not. Now, the answer is, why doesn't everybody know how to do this really well? And this is an answer that should be given mostly by a plastic surgeon, but from my colleagues that I speak to, working in the deep plane is a riskier plane to work in. It's much more technically difficult, and it's an easier surgery to do alternatives like some of the older techniques. So I think one of the things we're seeing now with the great demand and the hype around the deep plane is that everyone is saying they're getting a deep plane facelift. And it's just not true. I've had many patients that have gone for revisional surgery, and it's very apparent during the revision what was done in the prior surgery or not. So these are some of the things we have to be cautious of when we send patients for surgery of any kind. Unlike non-invasive or minimally invasive dermatologic aesthetic procedures that may be reversible. You can do revisional surgery, but sometimes if you have complications of facelift or body lifting surgery, they cannot be all undone. And if you don't like the way you look, it may be difficult to fix that. So that is something we're going to see a lot more of in the future. And it's not just straight ahead face tuning. Peptides and regenerative medicine. This is the main hype of the year in 2025. Everyone has been talking about things from GLP-1 peptides to BPC, 𝐻𝐸𝐯. It's a lot of acronyms out there. All these things that are used, these small amino acid chains we call peptides to stimulate activities in the body. The most common ones, as you know, are the weight loss drugs. These are the ones that are now FDA approved. These peptides are now not only spurring a whole new market of interest in weight loss and the aesthetic implications of that, but also dramatic interest in all the peptides that are not yet approved. And some of the ones I mentioned that are of huge interest, BP157, 𝐻𝐸𝐯, growth hormone secretagogues like sermorelin, ipamorelin, mitochondrial improvement. There's a whole long list of them I'm not going to go through, but people are getting crazy about them. And the regenerative tools that are out there are still very much the Wild West. I have a numerous number of patients that, the good news is they want to work from the inside, not just the outside. I wrote the Pro-Aging Playbook in 2019, released in 2020, where we really started the discussion about how beauty and wellness no longer sit on opposite ends of the cafeteria. And so much about how we look on the outside really starts from how we treat ourselves on the inside. And most importantly, it comes down to lifestyle changes, whether it's nutrition or it's exercise or stress reduction, weight loss, things of that nature, really optimizing your inside so we can do the icing on the cake on the outside. And in response to a lot of this working from the inside out help, we have the advances of regenerative medicine there. And I think this is one of the most promising things we're going to see, not just next year, but in the future. But like my common theme always is, when things are hyped, they're often polarized to the worst extreme and over-commoditized and over-marketed. And we're seeing this in the regenerative medicine, right? You've heard of things like salmon sperm facials. You've heard of PDGF. You've heard of PRP, PRF. There's so many letters. There are just so many letters. And to make it very simple, all these different products are chemicals, sometimes derived from our own bodies, sometimes derived from salmon sperm or other animal sources, exosomes, things of that nature. And they're used to hopefully stimulate, like peptides do, our own biological functions of rejuvenation, building collagen, building elastin, and using our body's natural mechanisms to do that, right? Because we're fearful sometimes of things that we put on our body from the outside. But unfortunately, these things don't always work, and they're not without risk. For example, salmon skin, salmon sperm facials. They're doing it in Asia. It's not FDA approved here to be injecting it into the skin. It's approved topically. Already I'm starting to see complications in my practice of non-healthcare injecting these salmon sperm products into the skin, which are not formulated to go into the body. Again, compared to fillers, much more risky potentially. PDGF, there just aren't that many comparative studies out there to show its efficacy. And if you go on TikTok, you have a lot of people in their 20s who swear it's the next beauty secret. But your average 40, 50, 60-year-old are really not going to get the benefits from this. So although I'm hopeful of the future of these topical and injectable techniques, I have low expectations. And that's how I look at anything new. I take in aesthetic medicine the things that have traditionally worked for everybody, and I stick to those, I optimize those, I maximize those. I'm always open to new things, and as you know, we always have new things at 𝐻-FrankMD. I'll get to those in a second. But I'm wary of new things because there's always a lot of hype around them. And social media and Google and even ChatGPT, which can be very useful but doesn't always supply the right information are the hot sources of medical and aesthetic therapy right now. And this is what we have to really be cautious about, where we get our information. And no matter what provider you go to, making sure it's an experienced, board-certified healthcare provider who has years of experience to weigh the really pros and cons out there, because so many patients come in with preconceived notion. And one of my biggest worries moving forward is the over-commoditization of these regenerative techniques. All right, well, let's talk about what we're going to do with all these things that we got from 2025. I think when it comes to injectables, my outlook really hasn't changed much over the last few years. I've been well aware that for at least 5 to 10 years, people have been overdoing it. Injectables only work for a couple of different aspects of aging. They don't lift, they don't change bone structure, and although there are a lot of biostimulatory agents that are out there that can tighten skin slightly, they just don't remove excess skin. And when people need surgery, whether it's for the eyes or for the body or for the jawline or for the neck, it's just time to do that. The misconception that people have is that they're never going to need injectables again, and that's just not true. Unfortunately, soon after surgery, people realize their Botox is worn off. In as little as a few months, they realize there are certain aspects of surgery that they didn't accomplish aesthetically, like around the mouth, volume loss around the mouth. Even when patients get fat transfer during surgery, it's usually not filling to the level of volume replacement that we want. We don't always get full 100% survival of fat grafting. So injectables aren't going anywhere, and if your surgeon has not really gone over what the maintenance may be afterwards, it's important you talk to your dermatologist or whoever your aesthetic provider was beforehand, because there absolutely needs maintenance. I was speaking to one of my closest colleagues, David Rosenberg, about this and what it means to need maintenance after surgery. And he described it to me as like refurbishing an old car, right? That's what facelift surgery is doing. You're replacing parts, you're refurbishing the fabric and the structure of the car, but you're not really going to appreciate the end result of that refurbishing until you do the detailing. And that's really where aesthetic dermatology and what I do comes in. It's the lasers, the injectable touch-ups, the scar treatments, the removal of the broken capillaries after surgery, dealing with hyperpigmentation, and all these things that really the surgeon kind of like checks off on, because unlike dermatologists, plastic surgeons may not see their patients more than a few times. They want to manage complications, make sure the patient has a good structural result, and then they leave them to the healing and their end result. And it's really, I think, one of the things we're going to see most in 2026 and onward is how to optimize the maintenance for these patients. We're seeing so many people getting surgery. In my own practice, I'm seeing so many follow-ups of people having surgery all over the body. I've optimized scar techniques that we're using. We have a whole new list. One of the newer technologies out there is Myria and 𝐲𝐢𝐈. We're using these technologies for scars all the time. We're using these devices all over the body. But really managing scars and managing the post-op after surgery is so important. And people have to realize that there is recovery. There are minor, I wouldn't call them complications, but there are expected adverse side effects of having surgery of any kind. And I think one of the things we are seeing is patients getting surgery younger and younger, as early as in their 30s and 40s. Now, because weight loss is a thing now, and a lot of patients are losing 50 plus pounds, there is a time and a place for young people to need surgery if there's just excess skin. But I think we're seeing an over-marketing of facial plastic surgery to young people. From a dermatologic perspective, one of the biggest peaks and changes of the skin in elasticity and sun damage and irregularities is in the 50s. So for those patients who kind of think that they're going to be 35 forever by getting a facelift at 42, they don't realize they're going to need surgery again in about like 5 to 10 years, because they're getting their surgery before that first middle-age peak of loss of elasticity and changes of the skin. They also realize that when you're in your early 40s, and you're still looking really good, you're not seeing the major changes yet of aging and elasticity, there's a smaller therapeutic window. Any adverse reactions or changes in color of the skin or scar formation or things of that nature, you're going to notice a lot more in your 40s than you do in your 50s. And I'm seeing this. I'm seeing a lot more dissatisfied surgical results because people are getting surgery too young. They're getting convinced into this like preventative surgery thing. It's almost as silly as the preventative baby Botox that was going around. I'm really seeing so much of the parallels and the overhype of regenerative medicine and pre-surgery that I did in injectables. I had a patient come in the other day and said, you know, she had recently had surgery in her late 40s and saying that, oh, she'll never have injectables again. And I'm like, just wait. You just had surgery. Everything looks great. You don't need it right now. But people have to realize that there's a balance of pros and cons with anything, and you always get the best result from a concerted effort of a lot of different things, not just non-invasive, but minimally invasive, even the more invasive things. And you know, it takes a village. We all want to live our best lives. We all want to look 35 forever, but it's really, you have to avoid doing too much of anything, and that includes surgery, because if you're having surgery in your early 40s, you're definitely needing it again in your 50s and your 60s and your 70s. And you know, plastic surgeons, especially the ones on the West Coast, I've said this before, they bash dermatologic procedures. They're anti-injectable. They're anti-devices. They're saying that all these things are ruining the potential for surgery, but what they don't realize is that all their patients are going to need these procedures to maintain their result. It's very common, as little as 2 or 3 years after a procedure, that people lose volume in the preauricular area. They need fillers. They need biostimulatory injections. This is such a common theme, and it's important that we map out a maintenance. So I think the next 5 to 10 years, it's going to be the decade of maintenance, even after surgery. And listen, I hope that the techniques and the acceptance of surgery continues so that everybody has a comfort level where it's part of the aesthetic vernacular, right? It used to be when Botox first came out and fillers first came out, when I was just graduating and I started my practice in 2000, no one would admit to getting injectables. Now, your average 30-year-old considers getting it done like getting a haircut. So these are some of the things that we're going to be addressing on a philosophical level in terms of maintaining patients. Now, again, knowing that we always have to combine therapies, we're always looking, in addition to our appropriate injectable use, to injectable-sparing technologies. We've had some great additions in 2025 because, again, it's going to be a concerted effort. M-Face. It's been an amazing addition. We had the M-Face eyes, which, you know, fillers could only handle and improve the indentations and the hollowing around the eyes, but a lot of people have puffiness. And the M-Face has really been a great adjunct and complement the under eye area to reduce the mountain of the puffiness while we can conservatively fill in the volume loss. And this has been a great injectable sparing technology that we use for all ages. 𝐻𝐢𝐳 continues to rise. It is still the only fractional microcoring technique where we could actually remove skin to tighten it. And I will use this all over the body for excess skin. I use it for a lot of patients that are pre-surgical ready. I use it for a lot of those patients who are 2 or 3 years out of surgery, or they're even 6 months out of surgery and they've had an imperfect result. Not a bad result, but an imperfect result, because people often go into surgery thinking that this is going to be my one and done, and I'm not going to be 50%, I'm going to be 99.9%, and it don't always turn out that way. So if you're left with a little bit of excess skin in areas, 𝐻𝐢𝐳 microcoring, which is really a kind of minimally invasive skin extraction technique, has really changed the game for that detailing we're looking for after surgery. And then again, years after, for people who are not ready to go back under the knife, the 𝐻𝐻𝐳 has been great, and we're using that all over the body. Resurfacing. People after surgery need resurfacing, and although they may have a procedure done during the surgery, it generally does not accomplish the type of results we can get months after. And that's true of treating fine lines, crepey skin, and any recourse of the surgery that we've seen, broken capillaries, pigmentation, things of that nature. Myria has really been a great addition to help people out texturally. I'm doing more CO2 fractional resurfacing lasers than I have in my whole career. We're refining those techniques, and it's still the gold standard. And really just learning how to treat patients post-op and optimize their care. This is a lot of where we're going to hopefully be seeing with the regenerative medicine techniques also. I do know a bunch of surgeons that are starting to use peptides like BP157 after surgery to speed up not just aesthetic surgery, but also orthopedic surgery. I use peptides myself during my tumescent microliposuction. We're using GLPs now. It's really not for weight loss. We microdose them, and we're really seeing dramatic improvement in the bloating of recovery. My tumescent microliposuction patients, it's a weekend recovery. They're back to work after a Monday procedure, but we want to get them bathing suit ready as quick as possible. And after any fat removal technique, there's some retention of water, there's some bloating involved. And not only do the microdosing of the GLPs keep their metabolic function optimized, but it really and dramatically decreases their inflammation and swelling. So that's such a great example where regenerative medicine is making a huge impact on our aesthetic surgery results. I think we have a long way to go in terms of research in what a lot of these kind of experimental only peptides are being done. We obviously have the GLP-1s, which every month we're getting new data and research proving what other applications they have other than obesity, from inflammation, cognition, longevity things, minimizing your risk of diabetes. I mean, it is endless, and I have so many patients that are using this for various applications and improvement of their health. I mean, every specialty in medicine has applications for these medications, and I really hope we get the research for a whole bunch of other ones, because other than the GLP-1s, the only other ones that actually have FDA approval are like the growth hormone secretagogues. Now, they're not FDA approved for longevity purposes, but at least they've had some serious research and have been reviewed by the FDA for some indications. But I'm really hoping the next few years really come with a refinement of knowledge on these peptides, because I think they are the exemplary future of what the pro-aging lifestyle is. And this is something I've been talking about for years, because there's only so much lifestyle changes can make. And I think the peptides are going to make a big difference. I hope we wean out a lot of the nonsense that we're seeing out there with regenerative medicine. Again, I have low expectations, but I am hopeful. And I just don't want to see the complications that I know are going to come up with a lot of the abuses of these medicines, from exosomes to PDGF and PRF. I mean, in the worst case scenario, I think we see very little to no results. And I'm not saying there are not people that respond to these things, but I only consider a treatment successful if the majority of people respond to things with low risk. And I'm just not seeing that with a lot of the regenerative medicine things. But, and I'll come to a close soon after this, 2026 and beyond is going to be a year of fat. And I love fat. Fat has been a curse word in society, and is, in many ways still is, but fat is still one of the most regenerative organs of the skin. And I've been working with fat my entire career, helping patients body sculpt, and I've done fat transfer for decades. With the advent of fillers and biostimulatory agents, fat transfer really, I used to do it on almost every patient I did body contouring in when I first started my practice. And then with the advent of other types of injectables, people just went to fillers, right? They're quicker, they're easier, they're in some ways could be more predictable. And fillers are still a standard of care, because fat transfer is a surgical procedure of some sorts and is minimally invasive. Surgeons do it when they are doing facelift surgery or breast surgery or other types of more invasive body contouring surgery. They move fat around. I do that myself. You always hear about my butt procedure. I'm doing non-BBL buttock augmentation. I use it to treat lipoatrophic scars. But I think we're really seeing a huge resurgence now. And with the advent of knowledge and how we process fat into microfat and even biostimulatory nanofat, we're really going to see this amazing part of the skin hopefully help people age better. Because of all the regenerative medicine tools that are out there, the stem cells that are found in fat, and again, the only other place where we see more stem cells in the human body are in the bone marrow. Fat is so easily accessible. We all have a little extra. And there are so many things we can do with the fat now, hopefully to improve longevity. And this is not just true for aesthetics, but I also think in regenerative medicine, orthopedic medicine, cardiac medicine, the access to the stem cells and the growth factors, connective tissue found in fat are going to be a secret weapon in the future. And as it is already, I'm starting for those patients who either need too much filler to maintain or want to minimize putting foreign substances in their body. We're back to doing microfat and nanofat in the body. You're going to hear a lot more about this on the gram 𝐵_FRANK_MD. And every year I think I'm going to run out of things to talk about. And every year I'm exhausted with the things I have to talk about because I talk a lot, as you all know. So you're going to hear a lot from me. I think we covered most of the things we want to cover in this year, and I'm super excited about things to come. But I'm very thankful for the career and the patients that have given me the passion and interest to be involved in this field of medicine and help people and make the world a more beautiful place. And I wish all my patients and all my viewers and anyone that has an interest in the things I have to say a really happy holiday and a happy new year. And I'm excited to babble on in 2026. So have a great holiday, everybody.